Welcome to True Health Tuesdays, and the truth will set you free. Okay, today, walking. Okay, you might think, gee, this is really everybody can walk. No. The cool thing about walking is when you learn the phases of gait, the pathologies, and the benefits of it, you're never going to go to a mall again the same. I guarantee. You're going to be seeing stuff. Has anyone ever seen like Sherlock Holmes or a fan of Sherlock Holmes? You know how he could look at you and just tell different things, like, where you'd been, what you have with different pathologies? That's what you're going to turn into. So when we talk about just walking, and I'm not talking massive stuff, you're talking just walking 1 to 2 miles a day lowers risk of blood pressure and decreases risk of stroke 40%. There's not a drug out there that does this. Walking, this is it. And people will say, well, it can't be that simple. It is that simple. Bone mass decrease, risk of decreased hip fracture, 40%. Again, just walking. And you're talking, it takes about 20 minutes to walk a mile. Age-related memory decline. Why would memory decline? Because we're stimulating both halves of the body when you're walking. Lowers Alzheimer's risk. Dementia costs 4 times in this country what cancer costs. So how about walking a mile a day to reduce your risk of Alzheimer's or dementia? Is that worth it? Yeah. Improves your mood, better than pain relievers, better endorphins. People will say, well, no, it can't be that simple. It is. It is. The body is designed for movement. Helps you live longer. And this is scary. People who exercise in their 50s and 60s are 35% likely to die over the next 8 years. I'm 58. That's like, dude, I'm going to be alive longer than 8 more years. What are these guys got low goals? But you got to put the studies up there. It's just, doesn't it seem odd? Because we do have sedentary lifestyles. So walking isn't just a little important, it's vitally important. And you're going to see some of the pathologies. Now they say that sitting is the new smoking. That's not true. Sitting is way more toxic than smoking. I mean, this is pathology central. If you figure that when we just talk about movement and cerebellar function, or how the brain actually works, symmetrical movement that you get from walking actually stimulates both halves of the brain. You get a sedentary lifestyle where you're not moving. And how many people in offices don't move? And I mean sitting for hours. And I have to demonstrate this for some people. Well, they'll say, yeah, I have an office job, I'm sitting down 4 or 5 hours a day. And I said, okay, I'm going to hold your arm. And I'll hold their arm firmly like this. And I'll say, what if I held this joint like this for 3 or 4 hours? Okay, I know. I've been here like 20 seconds. It's like, come on, man, let me just move. But if you're sitting there not moving, the discs of the spine actually get their nutrients through imbibition or through movement. So if you're not moving, those joints are literally getting compressed. So not only is a sedentary lifestyle altering brain function, decreases lymph flow, you're talking all types of cancer increase, all types of cancer. And we're looking at a 1 in 2 or 50% cancer rate in America. You're talking cardiovascular disease, depression, mood disorders. Why? Because that brain isn't getting stimulated. Memory loss, type 2 diabetes. You can't say erectile dysfunction if you're a man, so we call it ED. You like that I just said erectile dysfunction and I said you couldn't say, okay. Well, yeah, because this is the nether region. We don't talk about that. Okay, loss of sex drive. Okay, deterioration of health. And it's all because of lack of movement. And I like this. We're not programmed for sedentary lifestyles. Human beings are literally programmed for activity. The combination of both I love the way they word this. It's got to be British. Yeah, London. Accelerated sedentary lifestyle. That means hurry up and not move. I don't know. I guess weed's legal there. So when you look at this, and the constant food availability disrupts the ancient metabolic processes leading to excessive storage and energy, dyslipidemia, so this problem with fats in the blood, and insulin resistance, type 2 diabetes, just from lack of moving. Prolonged TV watching, and no, this is not just the Kardashians, okay? I'm talking just sitting there watching the TV. Nobody has seen the Kardashians?
Thank God.
Okay, no, man. Check out Swamp People or Kardashians. You know, they're both really interesting. But again, Journal of the American Medical Association, it's not just the TV watching, although the TV is going to have EMFs, it's going to have blue light, which is going to interrupt melatonin production. It's the actual lack of movement, okay, that you get staring at this. When we look at gait, I want you to be able to dissect it, because you're going to see certain pathologies or pending pathologies in people that you're looking at. As odd as this sounds. Now, when I was the lab instructor for biomechanics, and we had a number of different phases of gait, where there would be the swing phase, the heel strike, the flat foot, the toe off. You know, I mean, there's so many different biomechanical aspects that the foot goes through when you're doing that. We're going to break it up into two different things, the stand phase and the swing phase. Okay, now this is somewhat normal for walking. I say somewhat because we're not seeing the hands, and the hands aren't really moving correctly. Okay, so when she was walking, you can see the hand is in the same position. So demonstrating the gait, this is actually not correct, because when you're walking, your hands have to be moving. And the hands, watching the hand position and the motion is going to denote a lot of different pathologies. So we're going to look at altered gait walking. One of the things that we'll do is we talk about calf stretches, because if you're sitting 6 to 8 hours a day, guess what? You're not going to have good dorsiflexion or good movement of that calf. So if you don't have good stretching of that calf, you're going to start walking unstable or with instability. You're going to start moving with the hips, and that's going to mess up the gait. If you have odd-looking shoes, you're going to have an abnormal gait. Now, this is the most important thing, because we've been trained to think that shoes need a big old huge heel, you need a big old huge arch support, you need good supports like that. Okay, have you heard that? Yeah, that's not true. The foot is, and good, everyone sitting down, is a good design. I know it sounds weird, but it's been around for thousands of years, and if you utilize it, it works. But we need to have it utilized, because if you limit the motion, if you put an arch support in there, it's almost like you're not utilizing the intrinsic muscles of the foot. Now, this is going to the foot is going to bend this way and bend this way. Okay, supination and pronation. You supinate pretty much for support. You pronate for power. So the foot is not static. Okay, it's going to be moving all over the place. And you want full range of motion. I mean, that's why you'll look at the toe shoes over there. If you ever try a pair of toe shoes, it's going to be a whole different experience. Because you're going to say, wow, this is so weird. My foot's sore in different areas that it's never been utilized like that. And that's true. So what you want when you're choosing a shoe to walk in, you want something that gives you normal foot motion. You want protection, so you don't want to walk in the snow with something like that, but at least it's going to be, you want full range of motion. What they're finding out on marathon runners, they're having marathon runners run barefoot or using shoes like this, and it turns out that they have less strain on the hips, less strain on the knees, less strain on the calf. I mean, it's phenomenally important, but when we're talking walking, helps with brain function, helps with dementia, helps with cancer, do you think it would behoove us to have normal biomechanics? Yes or yes? Yes. Yeah, I'm going to make it really easy. So now, altered gait. Okay, when you're looking at somebody with a normal gait, okay, I want you to look at their hands. Okay, because when a normal person is standing, you can see thumbs just hanging by their side. What you're going to see in office workers, workout guys, gym people, the pecs are going to be overly tight. So they'll be walking around like this. So if you see someone walking down the road like that, they could have certain pathologies. They for sure got biomechanic problems. But just try it. Put your shoulders inwardly rotated like this and take a deep breath. I know. So if you can't deep breathe like that, what's going to happen to your blood pressure? You're going to have elevations in blood pressure, you're going to have all sorts of things. Now, if they're walking like this and the head's forward, they're going to have pathologies in the neck, they're going to have numbness and tingling in the hands. And we get people all the time, they'll say, yeah, doc, I had some shoulder issues and they shot it with cortisone, but they still can't fix it. I said, anyone look at your neck? No, it's in the shoulder, doc. It's not my neck. My neck's fine. See? I can move it just fine. And it's like, dude, are these guys blind and ignorant? You know, okay, so you start seeing this and it's like crystal clear. So look at how the person's standing. And what you're gonna see is the dominant shoulder is a little lower than the non-dominant. It's subtle, But you'll be able to see from across the room, is the guy, now I'm gonna drop it a little bit, is he right-handed or is he left-handed? You're going to see a little difference. Why? Because the musculature is a little bit heavier, there's going to be a little bit more use to it, it's going to be a little bit more mobile than the non-dominant shoulder. Then when you look at walking, when a person's walking, their arm should come up to the same level. What you're going to see consistently, and this could be with brain damage, okay, and brain damage today, you're talking, there's multiple endocrine disruptors, there's multiple drugs that can cause brain damage. Has anyone ever heard of Benadryl? NyQuil, Dayquil? Okay, yeah, major brain damage. Okay, this can absolutely damage the brain, but then you're looking at all sorts of other things. What about flu shots, neurotoxins? Just had a patient who took a muscle relaxant. More than likely they were doing non-steroidal anti-inflammatories, okay, which is like Advil, Motrin, Aleve, things like that. And those 20% of all heart attacks. He drops a muscle relaxant because he was hurt, and guess what? Heart attack. I mean, it's crazy, but see, this is a drug culture. This is ignorance. Okay, I'm going to teach you how to look at the biomechanics so that you can identify pathologies and correct them. So when you're walking, your hands need to be coming up from the same level. If you're seeing one hand coming up higher than the other, then we know that it's either a problem with the brain, could be a problem with the shoulder, could be a problem with the pelvis. Maybe there's not appropriate pelvic motion there. Okay, so could be a problem with the hip or the knee. See, looking at detective work, you can't just say, well, that's bad, what do I take to fix it? Okay, I know, you're right. It's 2017, that's what everyone's saying. Okay, I've got a bad gait, what can I take to fix it? No, it ain't gonna be the fish oil, you gotta look at the mechanics, you gotta do some real honest-to-God detective work. You're gonna see certain pathologies, people that are toe walkers, okay, and the toe walkers means that they've got tight musculature on the backside, and you'll see kids walking around where they're bouncing. You'll see really little tiny kids walking on their toes, and that's normal because they don't have they don't have full brain development. So when they're first walking, you're gonna see this. But if you see this in a teenager where they're bouncing along, man, particularly today, when teenagers are getting 69 doses of 16 different neurotoxins, vaccines, and we're seeing 1 in 2 with a chronic illness or disease, typically, since we're putting neurotoxins in children, you're going to see neurologic diseases. And is that like a shocker to anyone? You put neurotoxins in a small, growing human being, we end up with neurologic problems. I know, 100 years from now, they're going, duh. Okay, so look at the different phases of gait. Look at how the person walks. Look at the shoulder position. Look at the hand position. And look at how they walk. And I'm going to show you a couple of cool things. What about cerebral palsy or lack of oxygen at birth? Can you identify that? Yeah, that's called a scissors gait. There's so many different pathologies. And what I was trying to do when I was tutoring the biomechanics, teaching them, I was showing them to look at people a little bit different. You can look, but you might not see. So this way you're going to start to see subtleties. You're going to pull it out of the air. Because when I'm doing a physical exam, I'm going to be looking at the person, how their head's positioned, how their body's positioned, what symmetry of their eyes. Is one eye looking one way, one eye looking the other way? Is one eye slightly closed or open? What's the facial symmetry like? And I'm looking at all this stuff, and they're saying, no, I never had a neck problem. I never had an accident. I'm going, dude, you really did. No. I had a concussion when I was 5, but I'm 82 now. You know, I mean, it's like, you know, people just don't know. So when you're looking at a gait, and I'm going to demonstrate a gait now. Thanks, Chogo. Okay, so when you're looking at a normal gait, okay, you should be seeing the arms coming up at a decent level. Okay, when you're demonstrating a pathologic gait, and it's going to seem odd, but one hand is going to come up to a slightly different level. It's not a lot, it's just a little. Okay, if you see somebody walking with that, okay, they don't have a bad attitude, they more than likely have some type of upper motor neuron lesion, some type of brain damage, maybe even cerebellar dysfunction, where they need that. I mean, when you see autistic kids, they walk around like crack addicts. They've got an increased tone of the paravertebrals, just like a Halloween cat has an, you know, they have those arch back. You're looking at their back is pulled back and they're walking around and they're jerky like crazy. And you could say, man, they got sympathetic dominant. You know, they're not doing crack unless they're doing, you know, like meth. Have you heard meth addicts? You know what Ritalin is? Prescription meth. Yeah. So it's like, so we're training our kids to do this stuff. If you see a scissors gait where the arms are correctly like this and the feet are in, and you'll see somebody walking, you can say, wow, man, low oxygen at birth. That's a trauma. We need to treat cerebral palsy like it's a stroke to get them on cross-crawl exercises so the brain begins to develop. How would that be? Isn't this cool? I mean, we get people with traumatic brain injuries, they're called TBIs, and we'll get them, treat them exactly like a stroke. You treat Parkinson's like a stroke. You treat dementia like it's a stroke. You treat all of these different pathologies that people think are systemic, but you start with an appropriate gait and knowing that that gait is a window of how the brain functions. Does that make sense? And you thought it was just about walking. No, it's everything. It's all the detective work. So when you look at this, obviously when somebody has an alteration in gait, they could have a problem with the knee, problem with the ankle, problem with the foot. And you'll see this too. You'll see somebody with a slight limp or lean off to one side. Now, are they leaning off to one side because this is in pain or because this one works better? You know, and eventually, what my goal is that everybody watching this will never go to the mall again the same. People watching, you ain't going to be looking at the shoes. You're going to be going, oh man, bowel and bladder dysfunction. Because think of this, if you have somebody with an unstable, well, it's not going to make you real popular at parties. But if you see somebody throwing the hips forward like this, have you seen this?
Yes.
What are they doing? They're not moving the hips. Bowel and bladder problems, okay, obviously, you know, incontinence. And you can see this and you see it a mile away and you go, good God, get this fixed. Oh, no, I'm taking my cholesterol drugs, my type 2 diabetes drugs. I got some antacids and some drugs to make me sleep better. Oh yeah, that's why I'm so healthy. Honest to God. You see the gait and you go, Jesus, are your doctors completely blind? So look at this, look at the pathway, look at the walking. Because if you don't have, remember, walking stimulates the brain. If you're walking like this, you're getting appropriate stimulation. You're walking like this, you know, all over the place. What kind of stimulation of the brain are you getting? Completely abnormal. We were doing, preparing these brain samples in the human dissection lab. And it was one of the most brilliant neurologists, chiropractic neurologists, was walking. And this was back when I was a student. So I just had this table full of brains and I was doing slices, making slices. And we weren't going to eat them, okay? We were marking them. Don't be grossed out. No, it was a lab environment. So we're marking these structures in there. And I'm just doing these slices, and you mark all the different structures, you know, the hippocampus and amygdala and all these little things in there. I even got some sample pictures back there of what we were doing. And this neurologist walks by and says, hey, that person had a lower left leg problem. Now, he didn't see any of the bodies I took it out of. This person had a healed lower left limb amputee. And so the structures, the actual structures inside of the brain change based on stimulus. No, I want to hear, wow. So that means if you have an altered gait, you got altered brain function. Bam. Okay, so it's hugely important. So you don't fix the knees, you don't fix the foot, you don't fix the hip because it's going to make you walk better or more mobile. You do it for brain function. These are all it. Hemiplegic, okay, you're talking Parkinson's, Pheniston gait, okay, where they're leaned forward and they have that mass face. Again, that's all brain. You're going to see like half of the brain where you get a flexion contracture here and an extension in the arm. You've seen this. You know this is a left hemispherical problem. I mean, when I'm talking to the student doctors, I'll say, what if you have a flexor contracture here and an extension on the other side? Where's the lesion? So we know what part to stimulate. So if you see an altered gait, it has to do with changes in proprioception. Why are the changes in that brain's awareness of the body happening? We don't know yet. But if it has to do with neurotoxins, you got to regenerate the brain. And the brain's got phenomenal plasticity. Everyone here has heard of somebody with a stroke that they could recover. They could recover speech. They recover, movement. They relearn how to walk or how to move. Raise your hand if you've heard that. Everybody, okay? Why? Because the brain has plasticity. That means it can regenerate, but it regenerates only through stimulus. Only through stimulus. Now, what happens when you correct the gait? Look at the problem, okay? If you have some type of upper motor neuron lesion, correct it. You got to get, your nervous system healthy. That's going to be the chiropractic here to find the alterations. You may have to stabilize the pelvis. If you have that gait where you're swinging and you're like riding a horse, you got to stabilize the pelvis. If you have an alteration in knee function or hip function or ankle function or flattening of the feet, you're not walking with that beautiful coiled spring of a foot. The best thing to do, work your body. Find the problem. Understand that gait is vital. If you have orthotics, find out why. Just had a patient who's had orthotics for 15 years. And if you have orthotics, and remember, what's the foot supposed to do? It's supposed to supinate and pronate and balance and everything else. And if you have a plastic orthotic in there without some type of weird deformity, like, you had, some type of frostbite and you're missing all your toes, or you had part of your foot amputated. Okay, if you have a normal foot that just has flattening of the feet, find out why and regenerate it. Regenerate the arch of the foot. Allow the bunions to go away. You can actually get it to work correctly. Guess what today is? Say walk day. It's walk day. And you might think, God, 20 minutes ago, I thought it was walking. But now, so when you go to the store, take every opportunity. If you're driving, park in the furthest spot away. Okay? I know. And you thought he was just crazy. No, he might be, but he's smart on the walking. So just take an extra opportunity. If you're a few blocks away from a market, walk to it. Okay, plan activities for walking. This is what we do when we go to the boat. We always walk around the marina for a little bit. So go to extremehealthchallenge.com. It's going to be fun. Now, this one, on the 21st of January, Extreme Health Academy be blowing it out the doors. This is going to be a fun one. Now, any questions on walking or online? Okay, so I've got to repeat what you're going to tell me because I have a microphone. So you have a sister that was born with a forceps delivery. They pulled her out. She developed damage to the brain and developed a hand problem, like a flexor contracture, and a problem with the leg. Yeah, and that's not true. Oh, they said that she has schizophrenia now from the trauma, and you can't do anything except give her drugs. Okay, that's not true. And this is the cool part. Linus Pauling developed a thing called Now, this guy won the Nobel Prize twice. Okay, really, really smart guy. He developed orthomolecular psychiatry, and he was getting severe schizophrenics off of their drugs, functioning in society by giving them appropriate nutrients. But movement is a nutrient. So now, since she has alterations in movement, then that is going to have altered proprioception or altered stimulation. What I would recommend is she finds pressure on the brainstem, because if you're a little baby and you're getting your head twisted and pulled out, do you think there's a neck problem? Yeah, duh. Okay, so she's got to get to a corrective chiropractor, get an X-ray. You know there's going to be some pressure on the spine there. But also, correct movement of the spine is going to get the cerebellum, the little back part of the brain, working correctly. And if that's working correctly, that stimulates the frontal lobe. And the frontal lobe is anxiety, stress, schizophrenia, impulse control. It's everything. So movement is actually going to have a calming effect on the frontal lobe. Everything. And this is why kids with jerky movements who have neurotoxins. When you look at autistic kids, or encephalitis kids, or kids with these neuron diseases, they go in and they don't pet like an animal like this. They go like that because they need that stimulus. They don't know how hard they're doing it. So what you need to do to get that frontal lobe, which is involved in impulse control and schizophrenia and depression and anxiety, get it stimulated through symmetrical movement. And
is there a possibility to get the scar away?
Oh yeah, yeah. Is there a possibility to get the scar away or resolve it? Absolutely. There's always plasticity of the brain. We have one patient who's just probably the coolest guy you ever saw. Very, very bad brain damage from poisoning when he was 18. And so when you're in a catatonic state like this, what they'll do sometimes, now this is 2017. Did anyone in here think it's like modern? They cut the tendons here so his arms would lay flat, so it's easier to change his clothes. Okay, so because they didn't, I know, my nurse friend's seen this. Okay, it's completely barbaric because they're discounting the effect that if you can retrain the brain, you could regenerate neurons. Now this guy is relearning to walk. It's only been about a month, but he's walking better. We've got weights tied on his arms. Why? He can't move his arms because the tendons and stuff were cut, but at least we can get the shoulder movement. And even if you passively move it, if you have somebody in there passively moving it, okay, it can get the brain working correctly and walking better. He used to have two people to help him walk, and now his wife, who's like 4 foot nothing, 100 pounds soaking wet, she can help this big 6'2", 6'3" guy walk. So it's really cool. I think it's cool. Yes, sir.
Are flat feet and plantar fasciitis, is that something that you're born with, or is that acquired?
You're born with flat feet. Everybody is. Because they're not utilizing the arch inside of the womb. I mean, some people. Anyone run around inside the uterus? No? Dr. Ryan, I was thinking you would be one of the ones. No, because since you're not utilizing the muscles inside of there, you got flat feet. So you're born with it. But what happens is, as you utilize that foot, the arch forms and the nerves that supply it form. So it has to do with the nerves that supply the intrinsic muscles of the foot. And those come out of the low back. So if you have a problem with the pelvis, okay, like let's say you're walking around as a little kid and you fall on your butt a whole bunch, or you fall downstairs or have a trauma, then those nerves are always going to be compromised to the foot, and people will say, well, you were born with flat feet, you always have flat feet. And then you know the old joke, flat feet run in my family, and then you say, flat feet don't run. Okay. Well, I know it's a bad joke. Jeez. Flat feet don't run. But what happens is you got this, the arch of the foot is supposed to be like a spring. You've got the secondary tissue called plantar fascia on the bottom of the foot. And it's only supposed to be there for a secondary support. So when you're jumping around, okay, you got that so you're not straining the foot. Well, if the muscles are weak, that fascia on the bottom of the foot's always being utilized, and it's not for that. You're using it beyond its design parameters. So then it's going to inflame because you're damaging it. So that's called itis. So it's called plantar fasciitis. It just comes from weak intrinsic muscles of the foot. Ultimately, it comes from a low back issue. Fix the pelvis, stabilize the structures in the low back. Bam, it goes away in weeks. weeks. Yeah, if not days.
So all these surgeries that the athletes are getting nowadays for plantar fasciitis is wrong.
All the surgeries that athletes are getting for plantar fasciitis is wrong. I don't know. How long do you want an athlete to work? How much money is he worth to you? You know, if you're the athlete, it's a big deal because this is going to be damaging your body, and there's natural solutions. If you're the team owner and you need this guy to do a couple of seasons and you don't care, fine, shoot him with cortisone, don't worry about it, it's going to cause a limp or something. Load him up with a bunch of pain relievers, get him on the field and use him like a racehorse. You know, when he's old, just throw him away. Unless he's human and you actually got a soul and you got ethics and morals, and you're probably going to want to help him. I know. I mean, I know a couple of professional athletes, and they're really abused, and that's not right. That's not right. Okay. Now, next week, we're going to have a really cool subject, but I don't know what it is. Any other questions on Facebook?